Hey guys, hope you all are doing well. And today we are going to discuss about another psychiatric condition that is phobia. When I tell about phobia, one word will come to your mind that is fear. But phobia is not just simple fear, it's something beyond fear. So, we are going to discuss about what is that fear, how that fear would be, and how that will affect the day-to-day life of a person, and what are all the management of phobia. That we are going to discuss in this video. So, what is phobia? Phobia is a persistent and irrational, debilitating, excessive fear of a place or an object or a situation or an animal towards a place, towards an object, towards something like a situation. Create a fear means that is known as phobia. Phobia create anxiety in the person. When the anxiety will develop in the person means if fear aroused from phobia is uncontrollable, or simply I will tell you beyond your control, means that may lead to severe anxiety. And this anxiety could disturb your daily day-to-day activities, and in that point you need psychological or psychiatric treatment. So what are all the symptoms of phobia? There are a lot of symptoms we can see in phobia, like loss of body control or unsteadiness. If you experience phobia or if you experience simple fear also, these symptoms will come. But the particular symptoms are exceeding for more than 6 months and disturbing your daily day-to-day activities means that time we can consider it as the symptoms of phobia. So what are all the symptoms means? Loss of body control or unsteadiness. You cannot maintain a balance of your body. When you're trying to do something, you may get shiver. A trembling or tremor or shaking nature will in your body. Nausea and sweating of the body, that is another thing. You will get giddiness simply and you will feel sweating without a reason. Though you are not going out or though you are not facing sun also, you will get sweating in the body. Next thing is palpitation. What is palpitation? Shortness of breath. Your breath pattern will get changed. Sometimes you can feel or listen your heartbeat. Next thing is tremor or shivering of the body. Already I told you what is tremor. When you touch in the current shock, now how you will feel? A jerky movement will come in your body. Same way, tremoring will come if you are facing or if you have phobia. Another thing is headache and stomach upset. These are the common symptoms we can see in the case of phobic patient. And phobia cannot consider as a psychiatric condition until it disturbs you. That's what I've told you. Normal fear, normal nausea, normal sweating of body, or normal shortness of breath and all common for every person when the particular person is facing some unusual situation or unlikely situation. So normal things, normal fear we cannot consider under phobia. Phobia cannot consider as a psychiatric condition until it disturb you. If it's not disturbing you, for a moment it's coming and it's going out. Okay, when you're facing the situation or when you're seeing an animal or when you're seeing some object, you're getting an uncontrollable fear. And when you leave the place, your fear also going out. Okay, and that is not disturbing your body and mind means we cannot consider it as phobia. Unless until it disturb you, we cannot consider it as phobia. That's what I've told you. Phobia is an irrational, debilitating, excessive, persistent fear. Next, there are two types of phobia we can see. They are specific or symbol phobia or complex phobia. So these are all the two types of phobia. Specific or symbol and complex phobia. So now we are going to see what is types of phobia. First thing is symbol or specific phobia. Symbol, the word itself meaning is there. Symbol or specific. Towards a specific object or from a specific object you are getting fear means that is known as Symbol phobia. Fear in the sense irreversible, excessive, debilitating, persistent fear, guys. So, what a symbol or specific phobia means? Phobia towards a particular object or a situation or an activity or an animal. Then, mainly we see this in the childhood period comparing to adulthood, and that is the main important feature we can see in symbol or specific phobia. Mainly we see this in the childhood period, and when the child get older, this fear also will fade from their mind normally. And symbol phobia can develop while facing or seeing the specific situation. Again, the same thing I'm repeating. When you face the situation, or when seeing a specific situation, or when you are touching something, when you are seeing an animal, the fear will come. That's what we are calling it a symbol phobia or specific phobia. And again, telling this is prevailing in childhood period. And when you get older, in most of the cases, the symptoms will get fade. Okay. Now we will see some example for symbol or specific phobia. First thing is aviophobia, fear of flying. Aviophobia, a specific situation here, right? Dendophobia, fear of dentist towards a specific person. Hemophobia, this is the phobia of blood or injury towards a specific situation and towards a specific object. Acnophobia, this means fear of spiders. So towards a specific animal or insect. That's what I've told you. Symbol phobia or specific phobia means the phobia or the fear towards a specific object or to a specific situation or to a specific animal. Here you can see some major specific phobia categories which comes under symbols phobia or specific phobia. Towards natural environment, here you can see towards water, towards cloud, towards tree. That is like astrophobia, hydrophobia, dendrophobia. If it's coming to animals, like towards lizards, towards dog, towards horse, bacterophobia, cynophobia, equinophobia, towards a treatment, towards a situation. You can see other examples like trypanophobia, towards needles, dendrophobia, towards dentist, hemophobia while seeing injury or blood. Then specific situation like claustrophobia towards closed space, aerophobia while traveling, glossophobia when facing someone. So these are all some examples for symbols phobia or specific phobia. And few more examples are here like acnophobia, ophidiophobia, cynophobia, glossophobia, gamophobia, etc. So these are all some examples. So this is not only the number of phobias which we can see under specific phobia. This is just for your understanding. I'm giving some common phobias which we can see or which we can observe in our society, in the community, or which are all the things you have experienced in your life. And this is the second type of phobia, that is complex phobia. It mainly developed during adulthood. Then what I told you about symbol phobia or specific phobia. Symbol phobia or specific phobia developed during childhood. But complex phobia will develop during your adulthood period. So we can say this is the complicated form of phobia. Why? Because during your childhood, you are not involving in lot more activities. You are depending your parents or someone to get support to do your activities, etc., etc. But when you get older, you have to do lot of activities. You have to perform lot of daily day-to-day activities. But in that moment, you have complex phobia means definitely that will make your life complicated. And we can see very strong and deep rooted fear in people, very strong and deep rooted fear in people. So in that case, definitely the person require treatment. There are mainly two types of complex phobia we can see in adulthood period. They are agoraphobia and socialphobia. Agoraphobia and socialphobia. So what is agoraphobia? Agoraphobia means fear of open spaces. Agoraphobic people will try to escape from the crowd always, and they will stay alone. They will avoid the situation which create phobia or anxiety. They will never try to do travel, or they will not travel. They will maximum avoid do travel. They will not come to the crowd, never ever, because they'll get unusual, irrational, excessive, debilitating fear. And don't simplify the fear frequency based on my explanation, guys. It's something really beyond my explanation. When you feel it, when you see it, when you experience it, then only you can understand the frequency and severity of agoraphobia. So this is a major type of complex phobia. Second thing is social phobia. Social phobia is otherwise known as social anxiety disorder. Social anxiety disorder or social phobia means feeling too much anxious in social situation. Too much. Again telling you guys, don't simplify. Too much anxious means it's beyond my explanation. And they will not speak in front of the crowd. They will feel all are harassing them. They will feel that others are trying to humiliate them. They will feel that others will tease them always. They will think that others are always talking about them. And they will never open their mouth due to this complex feelings. So these are all some symptoms or something which can see in a social phobic patient. So these are all the major type of complex phobia and it developed during your adulthood. Then we will come to the etiological factors or risk factors of phobia. There is no simple specific reason or etiology or risk factor we can see behind phobia. We can see lot of etiological factors or risk factors. Any incident which the patient have faced, that is the first risk factor we can see in phobic patient. When you do the history collection or mental status examination, this is the main thing which we can see. Any incident which the patient have faced. Sometimes injury, sometimes trauma, sometimes misuse, sometimes rape, sometimes domestic violence or any other kind of problems they have faced during their childhood or sometimes during their growing period. Then genetic factors. Genetic factors also playing a major role. Studies are telling that genetic factors also will create phobia in the person. Then traumatic brain injuries. And another thing is substance abuse and different mental illness. So these are all some risk factors which can lead to phobia. While coming to the diagnostic procedure, it's really difficult to diagnose phobia because everyone will show symptoms of phobia sometime. Everyone, including me, including you, everyone is having fear towards something. So that is difficult to diagnose. A behavioral therapist or a psychologist can find out the phobic symptoms. And another diagnostic procedures include history collection and mental status examination. So through the history collection, through the mental status examination, the psychologist or the therapist will dig into the past of the person and will find out the root cause of their fear. Then, while coming to the management, cognitive behavioral therapy or CBT is playing a major role. The therapy focuses on identifying and changing negative thoughts, dysfunctional beliefs into positive or adaptive behavior thoughts. I'm adding the link of cognitive behavior therapy video. Please watch that video. You will get more information about what is cognitive behavior therapy, how it is functioning, and what are all the things we have to learn and we have to study to perform CBT and how a CBT therapist will work to change the maladaptive behavior into adaptive behavior. You can see the link here. Please click on the link and watch that one. In cognitive behavioral therapy, mainly what the therapist will do means the therapist will expose the patient into the fearful stimuli and make them to aware about the situation. So cognitive behavioral therapy is the major type of therapy which we are using nowadays to reduce the frequency or reduce the symptoms of phobia. And another thing is of course talk therapy or psychotherapy. Psychotherapy or talk therapy will helps to explore the feelings of the person. It will helps to enhance the confidence in the person. And while coming to the medical management, of course, that psychiatrists will suggest antidepressants and anti-anxiety drugs. They will show depression because they will try to avoid the situation which is giving disturbances to them. So they will keep on sitting in the room, and that may create depression in the person, and sometimes that may lead to suicidal ideation also. In that case, antidepressant drugs is the major type of medical treatment which we are giving to phobic patient. Second thing is anxiety drug. Of course, this is a type of anxiety disorder. So phobia will create anxiety in the person, and to reduce the anxiety, the psychiatrist will suggest anti-anxiety drugs, and that is otherwise known as tranquilizers. So here you can see some examples for antidepressants and tranquilizers. But comparing to medical management therapies, especially cognitive behavioral therapy, psychotherapy is majorly we are using for the treatment of phobia. And while coming to the nursing management, assess the patient, be alert for the signs of phobia. You should know about the signs and symptoms of phobia first before dealing or before caring a phobic patient. That's very important. And acknowledge the need for the patient. Assess the client to learn self-awareness. Then avoid forcing the patient to comfort the source of his or her fear. Interrupt the patient's attention to the feared object. Encourage to overcome the side effects with anti-anxiety and of course antidepressant medications, and encourage the patient that he or she can help himself or herself. That's a major thing, guys. He or she can only help himself or herself, because they should realize that this object or the animal or the situation is not going to do anything. So a nurse can encourage the patient that he or she can help himself or herself. So this is about phobia. So far we had a discussion regarding what is phobia, types of phobia, symptoms of phobia, what are all the risk factors of phobia, and management of phobia. Hope you understand, guys. Thank you.